Hi, everyone. Today we are going into the next podcast in our series of tropical child and adolescent health. Today we're looking at things from a slightly different perspective. We're coming from the One Health perspective, and we're very privileged today to have Dr. Merlinda de Costa de Freitas with us. She's one of only 28 veterinarians in the country of Timor-Leste, and she works here at Menzies School of Health Research in the Dili office with me in the One Health unit. And she has done some international speaking, and she's a very wonderful, clever veterinarian. So all the way from Dili, and sitting right next to me is Dr. Mere. So to begin with, could you explain to us what One Health is and why it's such an important approach to global health?
Thank you. One Health is more like a collaboration with animal health, human health, and environmental health. Because health of the people is closely connected to the animal, and animal and human is we share the environment. And One Health is matter because it prevent disease, protect environment, and it will build a healthier and safer for both human and animal.
Yeah, great. Thank you. And so as a veterinarian or as a vet, how did you come to be working in this One Health space?
Actually, in the beginning, I was having a dream to be a practitioner in companion animal. And when I was still a student, and I'm also still overseas. And after return back home, and there is how can I say, it's more likely difficult to start my own career to do my practice in the companion animal, my own clinic. So I got the opportunity to be work in One Health for a job, for my current job, a vet for Bruce here, and and at that moment I saw the animal like the disease like brucellosis, which is a genetic disease, and rabies is not only affect the animal, but it kills, it affect people as well. It affect like a lot of affect livelihood as well, like brucellosis. It's a cause loss in household. So I'm also, and now I'm very happy to be involved in One Health, and during now it's already more than 2 years. So during 2 years we work in collaboration. We work with Minister of Agriculture and Minister of Health, and also we work with close we call it multidisciplinary, like with human doctor, vet, environmental scientists. We work also with epidemiologists and community as well, and we share the knowledge. And because and we share a goal as well, and like everyone agree on the objective of controlling genetic disease, improving food safety, or reducing the environment hazards.
Yeah, it's so interesting. One Health was a kind of a new concept to me when I came to Menzies, but it's just so important, as you say, that multidisciplinary team work, because every animal health, environmental health, human, all interacts and affects each other. You've sort of touched on this next question about sort of the key sectors involved. But are there how do these different key sectors ideally collaborate? Like, do they best work together?
From my experience in our project, like we work in our team, we involve vet and human health as well, human health as well, like research nurse, and then we involve human doctor as well. So we do collaboration, like my part, I draw the blood and do interview with the cattle farmer about the cattle issues, about the knowledge and the brucellosis, while the human doctor and human research nurse, they're doing interview and collect blood in human. And we also raising the awareness in the community. When I'm more pleased explaining about the cattle and an animal health perspective, but for human health, for my human health professional, they explain in the true human health perspective, and we work with the lab scientists by we collect the samples in the field, but they are the one proceed the testing and analyze the samples, and the epidemiologists we collaborate, like they analyze the situation in Timor, how this disease spread, and then those things.
So yeah, it's very collaborative then, isn't it? So in what ways does the health of animals and the environment directly or indirectly affect the health of children? Why children in particular?
In Timor context, many areas of houses still with soil, and then kids are often play with the soil, they touch the soils, and also they play closely with animals, which is even, and also every household they have animals that are in more likely I could say that it's free roaming, or it's free roaming pig, cat, and companion animal as well. They moving around in the house, and then they can poo everywhere, right?
Yeah.
So there's no proper management on that. And if a kids play on the soil that a cat or dog poo on that soil, and then there is no treatment on deworming or regular deworming on the animals, then a soil can be contaminated with parasite eggs, and then if a kids play on that and they touch their mouth, then it can be transmitted to them, like a zoonotic parasite, like let's say toxocara, and children also more vulnerable to the zoonotic disease, and they still develop their immune system as well, and they also they don't have a knowledge about how the zoonotic disease transmitted, and then if there is no proper management, then they will get infected easily.
Yeah, right. Yeah, so that environmental exposure, poor hand hygiene, or whatever, those things contribute.
Yeah, those contribute.
Yeah, right. So you've also, I think, touched on some of this as well, but how do some of those zoonotic diseases like leptospirosis, brucellosis, and even sort of the avian flu affect children differently from adults?
I think in children, maybe the diseases can be progress quickly rather than in adults, because they still the children immune still develop as well, and make them less able to fight the infection effectively. So, and also there is long-term impact as well if a disease is a children affect children, then it will affect their growth, their cognitive development, and also they will be feel ill, and then they can be participate in school, so and affect their daily activity as well.
Yeah, right. Okay. Interesting. And so what are some of the lesser known One Health issues that might have a big impact on child health, especially in sort of tropical or low resource settings?
I think the issues more likely about this, like soil transmission, as I said before, like kids often play with animals, and also they play with the soil, so there is a contamination in the environmental, and then it can be transmitted to them. It's not only the pet companion feces contamination in the soil, but also like livestock poultry as well, because in Timor context, there is no proper management on the livestock and also the poultry as well. Animal is freely moving everywhere, and then kids also they share the same. Let's say they share the same environment. So
Yeah.
Kids are more likely we live closely. Animal would be human live closely. So if the environment is contaminated, then they will get the disease as well.
Yeah, right. One of the big focuses at Menzies is about antimicrobial resistance. So can you talk a little bit about antimicrobial resistance from a One Health perspective and why it matters for children?
Yeah, sure. The One Health, like AMR is a big issue now, and for the children is affect lot of things. Let's say if a kid is resistant to the antimicrobial, then it limited the option of antibiotics. Let's say since kids is resistant with this antibiotic, then for the future it limited the antibiotic choices for the future. So it also more likely cause a higher lead to the higher mortal risks as well.
Yeah. And so is there a lot of antibiotic use in animals in Timor? Or is that something you're still working on finding out?
Yeah, actually. But for IMR, one of my colleagues, we are in this separate project, so they are more focusing IMR, and then there is also a resistance in the animal as well. They working on the chickens and local chicken as well, and now their ongoing projects IMR in cattle, but there is no published yet. But for the chicken, there is a resistant.
Yeah, right. And some of those antimicrobial resistant organisms can sort of circulate between animals and humans and the environment, can't they?
Yeah, actually, they can be contaminate the environment as well if through it can be transmission to the meat as well if there's no proper cook or any or kind of that, and of course it will affect human and kids as well.
Yeah, right. What do you think are some of the biggest challenges to implementing sort of a One Health approach in countries with limited resources?
I think the challenges is actually One Health is new to Timor. I would say that One Health is new to Timor, like as zoonotic disease, brucellosis is already present long time ago, but it's more likely to be a neglected disease.
Okay.
And now, last year, rabies is present. So, like, there is I would say that since rabies is present, then it must involve human and animal health, which require One Health collaboration. So Timor is just now, I could say that it's very new to One Health, One Health collaboration. So the difficult thing about implementing One Health in here is like there is no clear framework and the data sharing as well between between different institutions.
Yeah, right. That data sharing. I hadn't thought about that. And yeah, I guess the sort of training at the undergraduate level is not particularly collaborative either, quite siloed too. Yeah. Can you give an example of a successful One Health initiative that's improved outcomes for children or adolescents, or just people in general, I guess?
I think I will highlight the way we work in our project because, as I said before, One Health is very new in here, and then we're still working on the One Health, and I think in terms of high level collaboration, in country collaboration, I'm not really know about the successful of One Health in the country level, but in our team level, in my especially my project, we work in collaboration. We share, like we did the seroprevalence in cattle and in human, and the data and the data that we get after the research result, we communicate back with the government and the decision maker, let's say decision maker such as Mal's is Ministry of Agriculture and human health as well. So we inform them that there is a high seroprevalence in cattle, and also this is and also the brucellosis exposure to human is present now in Timor. So I think this one is a good start point of successful collaboration.
Yeah, great. How do you see One Health contributing to better nutrition or sanitation for children?
I think this question is through the like in nutrition. If we, let's say, the animal health management, we deworming animal, like we treat, we deworming animal properly annually, and then and we make sure that animal livestock and poultry is healthy, then they will also produce the healthy animal products, which is healthy animal products contain a good nutrition for the good nutrition for kids and for the children to consume.
Yeah, right.
And also for the sanitation, as I say, in Timor, many animals are free roaming, but if you manage to keep animals properly, let's say we put animal in the pen, we'll put chicken in the pen as well, so the feces not contaminate the soil, then it's more likely we manage the sanitation. There is no contamination in the soil, and then kids will not affect the kids.
Yeah.
And then to the mental health, like many Timorese, they rely on the livestock. So some cattle farmer in the field, in the rural area, they call livestock is their saving.
Yeah.
They don't have saving in banks.
Yeah.
They have saving in animals. So
Okay.
when they sell the cattle to pay their kids' education. So if we let's say if we prevent livestock loss, and then we prevent livestock loss, and it will reduce the outbreaks, and it will cause low stress in the household as well. So the household will be healthy. There's no problem with the finance. When there's no financial issue, then the household environment will be healthier for the kids.
Yeah. So that sort of ownership of livestock is very important to people's whole livelihood and the way they
because like in rural area they don't have saving banks, and then even the ancestor or the parents, they transfer the livestock as a saving for the kids,
like their inheritance.
So that's that one. And then if let's say if we keep livestock healthy and then no outbreaks, then there is no financial issue for them, right? If let's say if there's outbreak, lots of livestock dying, then will be a big problem in the household. Then maybe a conflict between parents, and then it's improper for kids to see and affect their mental.
Yeah, true. Yeah, it can be devastating if that has big loss. Yeah. So what role do you see community level animal husbandry practices or food systems play in shaping child health risks or protection?
I think the community level, and the one thing that they can do is good practice protect child health. It's through you vaccinate your animals. Like in Timor, the government offer like septicemia biotica diseases vaccinate freely. There will be next year will be brucellosis disease in vaccination get will be free as well. And also rabies vaccination is free. If your family's parents that own animals willing to vaccinate their animals, it means that the animal is safe for zoonotic disease. We prevent the transmission to the kids because kids are often playing with their animals right then they don't know about what is rabies. Maybe they don't have. There's no. There is. They don't have. They haven't exposed to the zoonotic disease knowledge. So, with parents' willingness to vaccinate the animals, this is a small action that with a big impact. I would say that. And also the another one as mentioned, if you keep your animals proper, like you put in a pen and then no feces everywhere, no caution everywhere, then it's the areas, the soil is safe for kids to play.
Yeah. Awesome. So what can medical and public health professionals learn from veterinarians like yourself when thinking about child health in tropical settings?
I think the one thing that vet can share with medical health professional, it's more likely about the zoonotic disease. So how the zoonotic disease transmit to the I consider the transmission patterns, how like rabies, like how rabies transmit, like kids is more often kids are more often play with dogs, so they are more likely high risk to get rabies. So I think the one thing that we can share is the zoonotic disease, and then maybe animal have cattle manage animal health management. Animal health management, and also food safety as well, maybe.
Right. Okay. And so how can students, so our future public health professionals from different disciplines, work together in that spirit of One Health?
What I'm thinking about of the platform that brings students together. So like let's say a group create a group that a student create a group and that are lead by one health professionals or they invite or lead by medical health professional, environmental professionals, or animal health professional. So in that group, they share the knowledge. They're sharing like actual issue for the country and the One Health matters. How we have to work. We have to work multidisciplinary. So what the impact? I think the sharing platform is a good one. Or another one is through workshop as well. In the workshop we invite the One Health professionals. So One Health professional we share the importance of the One Health to the students. So expose them really about One Health, and also maybe I think this one is more difficult one, but I'm speaking of the Timor context or Indonesia context. Let's say because I was studying there, and maybe joint research students can be involved in the One Health research. This one's more effective.
Right. Interesting. Thank you. So having sort of shared language, shared goals, sharing data. So looking to the future, what are the emerging One Health issues that you think students should be paying attention to over the next, say, decade?
Yeah. I think the big issue is zoonotic disease. I'm speaking of like as Timor condition now, rabies is a main issue now. It's like, let's say, Timorese keep lose their lives due to rabies, especially children and and those under 20. They still have opportunity. They still have bright future, but due to zoonotic disease, they lose their life, and this is so sad. And then I think zoonotic disease is important because it affects human life. We suffer and we lost our life, and it's very sad for the family, parents as well. And also, it's very sad. I think zoonotic disease is an important one, and also the AMR, I can say antimicrobial resistant, because many infection you have to treat with antibiotic, a bacterial infection, but due to resistance, there is a limit the antibiotic choices, and it will complicate it and very headache. And I think this one is important as well, and also the environmental, because nowadays the population is growing and we live in like almost live next to animal. We really share the environment, and for the future this will be an issue as well, and environmental hazard will be an issue.
So that sort of emergence of more zoonotic diseases, that shared closer living environment, and then antimicrobial resistance, all important issues. For students listening today, especially those who are hoping to work in tropical child and adolescent health, what's one takeaway that you'd like them to remember about one sort of important thing that you'd like them to really think about?
I think the important thing, I think let's say children is a future. It's a future of country, or they still have bright future, and we have to protect them. So, and also like disease like zoonotic environmental hazard affect children the most rather than the adults. So we have to protect the children.
When you first decided to become a vet, did you ever think that the work that you would do would have such a strong impact on human health as well?
In the beginning, no, but after I enrolled to the vet schools, and then after I'm working in Mentis and doing One Health stuff, and I see that animal health stuff really affect human health, and we have to work in collaboration to manage this issue. And this one is affect livelihood as well, but seeing happy face in the cattle farmer and their smile, like, oh, I help a lot of people. Just happy.
That's really great. Are there any tools or books or resources that you could recommend for the students to sort of look a bit more deeply into One Health?
Oh, if I could suggest, then in animal health, there is really four stand for One World Organization of Animal Health. They have a report about the zoonotic disease or animal disease, and maybe we can have a look on that. And also maybe report from WHO in human health. And I'm sorry, I don't have any recommendation about environmental. And I think CDC is also good as well. And I think you can Google in the One Health Research, the One Health Research Journal, this was important as well.
Oh, okay, yeah. So that's a peer-reviewed journal called One Health.
Yeah.
Even? Yeah, right. Okay.
Yeah, it's I think journal is the better one because they keep upgrading like every year. There is a it's very, how to say, it's very actual issue like in journal.
Yeah, contemporary issues,
Yeah.
evidence space. Yeah.
The evidence base and
Yeah.
an actual issue as well.
Excellent. Well, thank you very much for sharing some of your wisdom and experience with us today. It's sort of looking at child health from a different angle to what we've done in the course so far. So it's been very interesting. Thank you very much.
Thank you, Mana, for having me.
Great.